What's up, Doc Mike? Today's topic for February 9, 2021. Johns Hopkins students answer the buzziest COVID-19 vaccine questions. Thank you, Johns Hopkins Bloomberg School of Public Health.
My name is Nea Prata Menezes.
Jana Shapiro,
Joanna Malone,
Katie Anderson, and I'm here today to answer some questions about COVID-19 vaccines.
Somebody wrote to us saying, got my first round, but I still want to know, can I still be asymptomatic carrier if I'm vaccinated? It is important to know that for the Pfizer and Moderna vaccines, you do need to have both of your shots to be fully protected, although really it's important to know that when it says it's 95% effective, that is specifically talking about at least preventing severe disease and deaths. We don't have enough information to know whether or not it actually prevents infection, then yes, it is possible for somebody to be infected asymptomatically and to potentially pass it around. So that's why it's still really important for all of us to still, wear a mask, socially distance, and wash our hands.
We have another question from Facebook asking, so in other words, millions of people who have been infected but recovered now have their own antibodies. Why would they need the vaccine? It's actually still recommended that individuals who have previously had COVID-19 still get vaccinated, although evidence suggests that individuals who recovered from COVID-19 develop antibodies. It's unclear how long immunity lasts after infection.
We got this question that says, I heard it, I guess referring to the vaccine, changes your DNA. Is this true? The short answer is no, it cannot change your DNA. And to understand why, we need to go back to our high school biology for a second. Our cells are like little containers, and within the cell, there's a subcontainer called the nucleus. And the nucleus is like the control center of the cell. And our DNA, which is the blueprint for all of the things that our cells and our bodies can do, lives in this subcontainer, in the nucleus that's inside the cell. The vaccines are messenger RNA or mRNA, and it cannot get into that nucleus. Since it can't get into the compartment where the DNA is, it can't even make contact with the DNA, let alone make any changes to it. This one came in via Facebook. With 2 so far vaccines available, do they have the same side effects? And yes, both mRNA vaccines do have a similar side effect profile. More than half of people will have a sore arm. They might feel tired with or without a headache after each shot, and it is generally worse the second time than the first shot. Less commonly, some people experience muscle pain, chills, joint pain, or low-grade fever.
Somebody wrote, if we've been studying these types of vaccines for decades, why haven't they been successful in the past? Something that is coming up a lot in the question of HIV vaccinations and how come we don't have a vaccine for HIV yet, since that is also an RNA virus. HIV and the SARS-CoV-2 coronavirus are completely different viruses. So the main point of a vaccine, ideally, is to have your body mount an immune response that, if you are naturally infected, would clear and defeat the virus. With HIV, we are not there yet at all because of the fact that even if your body has a natural response to HIV, eventually the virus is going to win out. And so it's been years and years and years of trying to get around this.
We received a comment on Instagram asking about what we know about vaccines in pregnancy. Neither mRNA vaccine contain ingredients that are known to be harmful during pregnancy or breastfeeding. We know that pregnancy does put people at higher risk of severe disease and death. And some pregnant people, such as essential workers and healthcare workers, are at greater exposure as well. We had a question about allergic reactions to the vaccine, and it says, what I haven't heard is that if you have an allergic reaction to the flu shot, you won't be able to get the COVID-19 vaccine. Most flu vaccines are made using eggs to grow the flu virus. And because of this, people who are allergic to eggs can't get the flu vaccines that are made this way. This is not at all of a problem for the COVID-19 vaccines, since no eggs were used to produce them. That being said, if you do have a known history of an allergic reaction or anaphylaxis to any of the ingredients in these vaccines, you shouldn't get them at this time.
We've gotten quite a few questions around medical mistrust, and one comment in particular from Twitter states the following: the distrust is so justified. I have read many historic medical accounts of the mistreatment of people of color in healthcare. We just want to acknowledge this comment and emphasize that this is an issue. The United States has a long and troubling history of medical abuse against Black Americans and other communities of color. And this has understandably led to high levels of medical mistrust among communities of color, including the disproportionate impact of COVID-19 that we're observing in these communities today. We will have a much more in-depth video addressing questions around medical mistrust coming soon, so stay tuned.